Perfect.
Perfect. It is a true honor and pleasure to be with you today. Thank you for allowing me to present in English. My Spanish is not so good, but I hope to share some insights with you from my perspective as Chief Standards Development Officer and Chief AI Officer with HL7 about this exciting era that we are entering in. I know from having participated in this conference previously how exciting the presentations are and how filled with innovation and great insights they are. And so I'm proud to be part of this session today. I wanted to start by just sort of recognizing that we are in a era of transformation. Throughout this conference, the presentations you will see time after time uh, innovations deriving from this transformative technology, artificial intelligence. Every day, there are new scientific publications about its use and application in healthcare, plenty of publications in the industry press, and so forth. And so I don't want to spend much time setting the context for why AI is important now, but I thought I would share one survey result that tried to capture that a little bit. The key messages are that most leaders in healthcare believe that generative AI is going to be a truly transformative force. And in particular, both providers and leaders within healthcare institutions are expecting AI to transform and reshape clinical decision making within a relatively short period of time, 3 to 5 years. And that's also happening at a time when the investment in artificial intelligence continues to rise. But we must recognize that this is still relatively early in terms of wide scale deployment. And so many of the things that we are seeing described in the literature and described in the popular press are relatively new. And many of the pilots that are happening now are not going to be or have not yet reached production status. And so one of the things I like to reflect on are some of the trends or the forces that are consistent over time. This book by Kevin Kelly, which was published, I believe, in 2017, describes some of the underlying technological forces that are continuing to shape our future. And of course, the book devotes a lot to artificial intelligence as one of those forces. But a key point is that the amount of information that we are producing today is the fastest growing quantity that we can measure, faster than the amount of cement we're producing or laying down, faster than carbon emissions, faster than essentially anything. And so within healthcare, that increase in the growth of information production presents a real challenge. But that challenge isn't necessarily new. I think back to my mentor, Clem McDonald, who began work on computer-based reminders and decision support systems in the late 60s and early 70s. This paper from the New England Journal of Medicine in 1967 is titled Protocol-Based Computer Reminders, the Quality of Care, and the Non-Perfectibility of Man. A marvelous title for a paper. And one of the key points that this study demonstrated was that not only can computers inform and improve clinical decision making, but the reason why people, humans, clinicians, often make mistakes or overlook things is really due to their limitations as a data processor rather than correctable human deficiencies. And this growth in the amount and kinds of information that need to be considered in our decision making only compounds that problem. Now, Clem went on to recognize that a computer's ability to improve human decision making in healthcare depends entirely on the computer's ability to have within its purview the right amount of information, the total picture of information that's necessary for the care of a person or a population. And that remains a large challenge. If we fast forward today and think about the application of artificial intelligence in healthcare, it's easy to get caught up in the glamour, the flashiness of fancy algorithms, fancy techniques, and so forth, and forget about or pay less attention to the underlying data work that's necessary to make those technologies work properly. I love this paper by the Google research team called Everyone Wants to Do the Model Work, Not the Data Work. And they go on to talk about data cascades in high stakes AI applications, where in their description, high stakes applications include those industries and scenarios where there are potentially significant safety impacts of AI. And healthcare, of course, is one of those things. The authors say, paradoxically, data is the most undervalued and de-glamorized aspect of artificial intelligence work. And that lack of recognition for that process tends to lead to poor data practices, which result in these data cascades, which they defined in this paper as these compounding events that cause negative downstream effects. And so bringing this back to the role of standards, it's clear that the use of open data standards is crucial for enabling high quality data, both in terms of access to that data through interoperable means, as well as the representation of that data in a consistent and well validatable format that machines can make good use of. You've already heard from Diego about the emerging and growing global adoption of the HL7 FHIR standard. We believe FHIR is truly a transformative open API specification and data model for representing health information. But in addition to its role as this important specification, equally important is the community of practice that continues to adopt and drive its evolution forward. That community is really a global participatory situation. This image shows you the participants in HL7's community worldwide, with more than 98,000 participants, really coming from nearly every corner of the planet. You can see little dots just about in every geographic area. And that's continued to grow. So just within the first 2/3 of this year, we've seen more than 5,000 new people from over 129 different countries come into the HL7 community to participate in education and in standards development and contributing their ideas. And so we're really excited about that. As Diego mentioned in his last presentation, there are many potential reasons why adopting FHIR or adopting open standards is an important part of driving innovation and interoperability and other kinds of care improvements through health information technology. And in fact, that sort of dual purpose of wanting to enable innovation combined with regulatory forces within different jurisdictions are really the two primary drivers for why FHIR is being used. As a platform standard, FHIR is meant to be used in many, many different health situations, health use cases. And that is an enabling capability because the investment in moving to FHIR, enabling FHIR-based access to data is one that can serve multiple purposes if we make that investment upfront. Just as an example of the kinds of use cases for which people within the HL7 community are using FHIR this year, I selected a few different projects where implementation guides are being developed to describe how a given group of stakeholders is using FHIR. And you can see that there is a pretty wide range. For example, defining core data elements for use and exchange in oncology care, to exchanging data between different healthcare payers. Certainly there's consumer-directed exchange. We have new techniques such as smart health links, which is a QR code-based exchange of verifiable health information, to even some areas of health knowledge representation that you might not be familiar with as part of the FHIR specification. So the ability to represent knowledge assets such as evidence-based practice summaries can be done within the FHIR standard as well. So lots and lots of different applications, and we're excited to see this continue to push ahead. Certainly, you can see the growing role of FHIR in enabling innovation, both specific to artificial intelligence applications as well as more broadly in health informatics by this summary of the informatics literature. And you can see a steady growth of the number of publications happening over time. This year, we're predicted to have around 150 or so scientific publications specifically about and relying on using FHIR. But I want to emphasize for you that FHIR as a foundational infrastructure or platform standard is one important part of the solution. But HL7 itself has produced a wide range of specifications that together represent a set of components that can truly enable innovation across lots and lots of different use cases. Sometimes I call these cheat codes, i.e. from the gaming context, but you might also think of this as mix and match components that you can bring together for deploying innovation within the particular context or use case that you have. So certainly FHIR as a standard provides semantically interoperable health data at scale. The Smart App Launch specification provides a standards-based way to integrate applications that are interacting with FHIR data, solving the sort of general problem of authentication and authorization for those third-party apps. There's also a technique called bulk FHIR, which is a simple way to request a large collection of FHIR data about a patient or about a cohort of patients, which is super important for a use case like model training, where you want to use existing healthcare data as the basis for training a new model. And this provides a convenient way to have access to that. I already mentioned the new standard that was just published this year, Smart Health Cards and Links, which provides a technique for using QR code enabled or URL shareable mechanisms to provide access to verified health data, whether that is a collection of immunizations or a patient summary. And this is really an enabling technology for consumer-directed healthcare data exchange use cases. We also have a standard called CDS hooks, which is a technique that really enables integration of third-party decision support technologies into the workflow of clinicians using health information technology such as an EHR, so that when the clinician does a particular action, they say open a patient chart, or they begin to open a order session, that action can call out to this decision support system in a standardized way, providing the context of information about the provider, the clinical situation of that patient, send that to the decision support system, and then receive back right in that workflow the recommendations for that system. A really sort of truly transformative technology. In addition, HL7 has a standard called CQL, which provides a technique for representing standardized clinical knowledge and the logic for calculating metrics in the case of quality measurement and reporting. And this capability is meant to be used and can easily be used with FHIR as the underlying data model for that health information, and really enables a lot of truly pioneering use cases. And then the last component that I want to mention here as sort of a key enabler of AI-driven innovation is the terminology that undergirds the FHIR specification itself. So the terminology, of course, we use in wherever possible, the large internationally accepted terminologies like LOINC and SNOMED and so forth. But there are other parts of the FHIR specification where those terminologies don't have sort of coverage. It's more sort of working knowledge. And I will point to some examples of the representing the metadata about provenance of information as being a key component to enabling the trustworthiness and the transparency about AI application. HL7 recently added a whole collection of codes to its structural terminology that enable better tracking of information as it say is used in model training, or recommendation comes back from a model into a health record, and keeping track of that type of scenario. So in total, that package of standards-based components can really be used in lots and lots of different purposes. And I believe that it's sort of enables endless possibilities for innovation. Within the standards development community, we are focusing a lot of our energy in the preparation of the next and likely sort of final version of the HL7 fire standard, release 6. And the community has been working its way through a series of sort of draft ballots to get input and feedback on the final set of changes that we're going to be incorporating into the standard, and looking ahead to the January ballot cycle as being our first ballot of a normative version of the fire release 6, which is going to be sort of a standard that has a major focus on maturity and serving as a platform for future innovation that's stable. You can look in this image at the sort of progressive maturation of the resources, or the little information models that are contained within FHIR over time by release. And you can see that we've been making sort of progressive progress towards maturing those resources, but FHIR Release 6 is going to have a very significant focus on that. And that has been driven by the wide-scale adoption and the feedback that we've gotten from the implementer community. So all of that in context, HL7 itself as a standards development organization has been thinking a lot about the role of artificial intelligence. About 2 years ago, the board of directors established a task force that began to explore different ways in which artificial intelligence not only was going to influence healthcare delivery, but how interoperability and standards-based data exchange would need to adapt and support those new use cases. One of the outputs of that task force was the establishment of a AI office within HL7, and I'm pleased to serve as the first chief AI officer. The idea of establishing this office was really to bring a focus towards how HL7 can help serve as developing interoperability standards for the AI era. This involves both coordination and collaboration with lots of different stakeholders who are playing different parts in establishing governance frameworks for safe AI and so forth. But really, we wanted to be a place to bring the perspective of interoperability to that AI conversation in a way that we can ensure that we achieve the potential for everyone to live in optimal health through this enabling technology. And so I'll describe the 4 key work streams that are operating under this AI office as sort of how we're thinking about how our role can be in enabling innovation with AI through a standards-based process. So the first is continuing to build the AI-ready implementation stack for healthcare. About a year or 2 ago, we published a first white paper on this around the AI ML data lifecycle. This provides best practice guidance, particularly in the early phases, so sort of design and development of AI models, and how standards-based data can and should be used in that development process. We have a new project that started this year focused on enabling the key characteristic of transparency in AI-driven applications. And this is really helping to clarify and provide guidance about how to use FHIR and other HL7 standards, but primarily FHIR, to record with precision the way in which data is going into a model, whether for training or for, in the case of use on a particular patient, their data going into that model, as well as the outputs of that model coming back into the health record system, and how to best track and tag that data, as well as techniques for representing how different operations defined by the FHIR API standard, which might behind the scenes be using AI to execute through business logic and other sort of parameters. How can we best represent that AI is being used in those contexts as well? So really exciting work there, and if you're interested, I encourage you to join that. We also have a couple of cross-cutting projects that are not specifically about AI, but have a high value and use in AI situations, which include our continued conversation and development of detailed provenance tracking, as well as a project called the Patient Information Quality Improvement Framework, or PIQI is the acronym, PIQI, which is really seeking to describe a framework for scoring and understanding data quality. And of course, its representation in standards is crucial for that. Lastly, there are a couple of incubator ideas or emerging, topics that are happening that I thought I'd mention. At our last Connectathon, we had a great session exploring what might be known as language-first interoperability or conversational interoperability in the world of AI agents, where language is sort of the input, but behind the scenes, those agents might be talking to other agents through A2A protocol and have access to a variety of resources through, say, MCP to interact with tools that can deal with FHIR data and then use that information, whether in aggregation or analysis, and provide that back. And so really exploring what does interoperability look like in this sort of framework where there are agents. We also have begun to engage in a variety of conversations about how individual healthcare institutions might be interested in exchanging data about how their model is performing once it's deployed. How does it change over time as new data is interacting? What are the sort of clinical parameters that might be important to be tracking to understand whether that model is actually doing what it was intended to do? In what ways are the assumptions about bias and fairness sort of holding up over time? And the idea of being able to share that knowledge between institutions in a standardized way is a conversation that HL7 is looking forward to facilitating. As I've mentioned, the second work stream is really sort of about a recognition that this is a global enterprise and that there are many stakeholders and partners who are working on this. And HL7 wants to be a good steward of that community, contributing our expertise in specific topics like how standards-based AI can be used to help with countering healthcare fraud and improving the payment integrity, as well as just being a global driver of innovation through a process like our HL7 AI Challenge, which received submissions from innovators around the world, I think every continent except Antarctica, to highlight how standards were powering their AI enablers. And so this work stream is really about that facilitation. And third, the work stream around our innovation lab is really a focus sort of internally. I would guess that many of you, most of your organizations are also thinking about, well, how can we use AI internally to do our work better? And certainly as a standards development organization, we are asking ourselves that question and applying AI both to the participants in the standards development process, as well as the work of creating consensus-based standards and seeking to be implementers of AI and users of AI for that work as well. And then the last work stream, the fourth work stream that's happening, is really focusing on enabling community excellence. And so in particular, I'll call out my colleague Diego, who leads our education and outreach activities. Certainly, we are hoping to enable the global health IT community with best practices for standards-powered AI implementation. And so that includes sort of educational opportunities and learning series. We have a program that is being repeated now around building FHIR-powered healthcare AI agents. And so it's a really neat opportunity to learn how you can use AI agents, but having access to an interaction with FHIR source data on the back end. The role of AI was a feature of our recently concluded September plenary theme, where we were challenged to think about sort of new applications of this technology and the ways in which interoperability and standards could best serve a safe and reliable and effective use of interoperability. And so we'll continue to sort of help not only help our own standards development community learn about AI and use it, but also facilitate the entire health IT community with these best practices through our work here. So in summary, I hope you have a glimpse at and a recognition of how HL7 standards and open standards in general can really serve as rocket fuel for supercharging your AI-powered health innovations. And I hope that you will join us and participate in HL7's activities in this regard. A good place to start might be joining our online chat at chat.fire.org, you can look for the channel or the stream that's devoted to AI activities as I've linked up here. So with that, I will say thank you very much.
Thank you. Amazing. We have two questions, very interesting questions. The first one is Diego translated in the chat, but is AI changing the way to define standards? Will we need new standards? Do you think the standard created before the AI will still be relevant in the future?
Ooh, these are good questions. Yes.
Yeah, very nice question.
So, okay. So we could talk all day. I will try to be very, very sort
Yeah.
of concise and brief. Um, so AI is changing the way we create standards themselves in terms of, I'll say, tooling, information synthesis, transformation of information from one form to another. So as we might start with a written summary of a use case or a scenario, AI tools can help us translate that into computer-based representations quicker and easier. So there's sort of that component. I tried to describe some of the aspects in which our existing infrastructure or our existing standards both enable AI today, but also as people seek to uh, deploy AI in the ways that support their goals of transparency, trustworthiness, explainability, and so forth, we know that there are parts of the standard that need maturation, additional guidance, and potential improvement as well. For example, although today it's enabled by FHIR, I'm not aware that there's much guidance or demonstration of how to do it. When we think about AI and explainability, the idea of a model such as an LLM or other non-deterministic AI application is a bit of a black box. And so clinicians' acceptance of that into their workflow can be hampered because it's hard to explain how it is that this model came up with this suggestion, this result, this prediction, et cetera. So the techniques for linking what the model produced as an output with the underlying clinical evidence or the key features of the data that the model detected and representing that in a structured way so it can come back with the suggestion, the prediction, the result is something in which standards can support, but will probably need additional thought and energy to describe. So I would say that's one demonstration of sort of how the standards will sort of need to evolve. And then lastly, do we need new standards? That's a great question. It's one we're wrestling with. I think the at our last Connectathon, it was sort of an open question of, well, do we need to either contribute to protocol specifications like A2A or MCP, model context protocol? Do we need a healthcare specific profile on that in the same way that the Smart App launch guide that we have today is sort of a profile on an underlying technology specification like OAuth? I don't think we have answers to that, but for sure, that's part of our ongoing question. While you're very welcome to participate in HL7's discussion on that.
Thank you so much, Dan. We have another
My
question, but
pleasure.
Diego answered in the chat. So,
I'm
and
grateful for Diego in that.
yeah, he's part of because it was about certification and about some kind of AI certification. But as a Diego is the boss of the certification plan for the HL7, he already answered in the chat. So thank you so much,
Great. My pleasure.
and always a pleasure to listen to you. And
Thank you.